Morning.
And your name is?
I'm Jim Makovets.
And we have your written verbal permission to take you?
Yes, you do.
And if I put it on my website or social media for educational purposes, that would be okay?
Absolutely.
Now, you recently moved down to the area from my old stomping grounds up in the Lehigh Valley, correct?
That's correct.
And you came down here, and what happened?
Last July in 2024, I felt horrible and went to a patient-first urgent care and ended up having very high blood pressure. At the time, I had not transitioned all of my doctors, and the recommendation from patient first was to put me on amlodipine. I was already on lisinopril for my high blood pressure.
Okay.
The doctor coordinated that with my primary care still in the Lehigh Valley at that time. Mm-hmm. And then he said, well, you haven't had an echocardiogram in quite a while. Why don't we get you one, especially with your blood pressure being high. Mm-hmm. Blood pressure was high, had an echocardiogram, was recommended. I see a cardiologist, of which I did, was recommended to one. He then recommended a transesophageal echocardiogram to kind of confirm results.
And what did they find?
Severe mitral valve regurgitation.
Mm-hmm. And both leaflets were prolapsed.
Yes.
And it was interesting. I mean, did you have shortness of breath before?
No, I had no symptoms. I was diagnosed.
But you didn't feel well.
That day, I didn't feel well.
Yeah. But so overall, it was a surprise to you.
Absolutely.
And it was really torrential. I mean, it was 4+ out of 4 leakage, and your heart was enlarged.
Yes.
And so 4 days ago, we performed mitral valve repair by leaflet mitral valve repair. You have a syndrome known as Barlow's syndrome, where both leaflets are thickened and prolapse. And the repair, well, it looks beautiful. How do you feel?
I feel really good.
Yeah.
I mean, compared to the first day,
first day's tough.
I will tell everybody.
Okay.
I have some friends that have had other valve repairs, and they warned me.
The first day.
The first day is tough.
Now the second day we removed the chest tube drains.
Yeah, the test. Yeah. Once as the tubes are removed, you do feel much better. So now I'm anxious to get home and just get back onto almost a regular type schedule.
And we're going to send you home in the morning.
Yep.
And so now that it's 4 days out and you're getting ready to go home, do you have much pain now?
No, I really don't.
Okay.
A slight discomfort learning that you can't use your arms when you stand up, when you get up off a chair or something.
So it really is a quick recovery.
I think it is. I really do. I'm.
And we use the conventional approach through the sternum.
Yep. Yep.
It feels okay.
Yep.
It's not as scary as people say.
No.
Of course, the first day, listen, even a small incision, I had a little hernia type incision, and I was complaining for a while too. But
yeah, I mean, this is not my first major surgery, so
you have something to compare to.
Absolutely.
But you're doing well now, and you're going
understand.
Home with a beautifully repaired mitral valve, and we also placed a clip on the left atrial appendage to prevent the risk of embolic stroke if you should develop atrial fibrillation. But you're in normal sinus rhythm.
Sounds good.
How is the care here at Jefferson Einstein Montgomery Hospital?
Care here is phenomenal.
Yeah.
Moving into an area where you have to pick a doctor and you have to pick a practice, and you who do you go to, even to the point of picking your veterinarian.
Yes.
We came here because, number one, it's very close to my home, but also from the recommendation, and I do my homework. I look at websites and I look at reviews, and this has definitely continued with the care that they've given me, that what was stated on the website. That's been excellent care.
Good. Well,
excellent.
We enjoyed taking care of you, and congratulations. And it looks like the weather is going to be good shape to go home on Memorial Day.
Sounds good.